Hello, and welcome to today's Rate Fast Speed Seminar. I'm Dr. Alchemy, and we're going to be talking about maximal medical improvement. Let's start out by defining that term, maximal medical improvement. The shorthand is MMI. In California, we use the AMA Guide's 5th edition, and maximal medical improvement is defined as a condition that's well stabilized and unlikely to change substantially in the next year. Check out page 2 of the AMA Guide's 5th edition for the full definition. Now, this term, MMI, when it's used, also means that all available treatment has been completed. For example, if a back injury occurred and the employee chose to use medications and go to physical therapy, but perhaps was also offered chiropractic and declined, that patient would then be at maximal medical improvement because all available treatment had been completed and or accepted by the patient. In this next slide, which we refer to as nerd knowledge, it is the provider that determines the date of the maximal medical improvement. Now, obviously, the provider has to have feedback and dialogue with the patient to make that determination that all reasonable and available treatment has been performed, and also make a determination if those treatments are contributing to any further improvement in the individual's functional measurements or functional limitations. Now, what does that mean? That means that if I'm tracking the recovery of your back, and you can flex 60 degrees and then undergo 6 visits of physical therapy, and now you can flex to 70 degrees, you've made an active gain. More therapy and or time may be indicated, and you're not at maximal medical improvement. Likewise, let's say that you can flex to 60 degrees, you undergo more physical therapy, you still flex to 60 degrees, but now you're able to lift 50 pounds as opposed to 25. You have still undergone, as the injured individual, continued improvement and are not maximally improved at that time. Again, you could lift 25 pounds before, and now after therapy, you can lift 50. So it needs to be determined that if more treatment is indicated, will you be able to lift up to 75 pounds after the next round of physical therapy or continuing at home exercises? These are the questions that the primary treater has to determine before they can make the decision on the MMI date. And finally on this slide, we want to be very clear that when the individual is determined to be at maximal medical improvement, it's now time for the permanent impairment rating process. Now we're going to do a little case. A primary treating physician has decided that their patient, a carpenter who has a right wrist injury, is MMI on January 1st, 2014. A permanent impairment report is carried out and a PR4 report is completed. 6 months later, for whatever reason, the employee sees a panel QME for an examination of the wrist. The QME determines that indeed all available treatment was performed and the functional measurements are unchanged and the activity limitations of the individual are unchanged as well. The question is this: what is the date of the injured worker's MMI? The answer: January 1st, 2014, because all available treatment and functional limitations were first determined at this date. The panel QME found no additional treatment indicated or any changes in the activity of the limitations, and therefore no changes were indicated and the MMI status remained. Join us next time for more Speed Seminar, and if you have questions and would like to read more, please come to our blog at rate-fast.com. Thank you for joining us.